We're going to demonstrate how to make a temporary crown using these models. This being the pre-op model of tooth number 2, and this being the crown prep or post-op model of tooth number 2. And so in order to make a temporary for this preparation, we have to have a mold to make it from. So before the dentist is going to prepare the tooth to this shape, we're going to take an impression of the existing tooth to make a mold to make our temporary. So we're going to turn this like this, and we're going to use our regular putty, which I'm going to need to mix without gloves on. We're going to start with 2 marble-sized pieces like this, and we're going to just start mixing them together in the regular fashion. Again, trying to get a uniform color. And since tooth number 2 is, really don't need all that material, tooth number 2 is the one we want the mold of, I'm going to push this down around the tooth like that. I think you can see that it covers the gum line and goes all around the tooth. Now we're just going to set that aside until that turns to hard rubber, and then we'll have a mold of the tooth before we start preparing it for a crown. Okay, we're going to look at our impression now. The putty has set around our pre-op tooth, and we're going to just lift this off and take a look. And as you look underneath, the tooth in the middle right there is the tooth that's going to be prepared for a crown. So this putty mold now is going to serve as our mold to make the temporary. We're going to fill this up with some plastic material and then place it on the prepared tooth, and you'll see that it makes a nice plastic temporary tooth. So we're going to do that next. Here's our temporary acrylic material, and like just about everything in dentistry today, it comes in a gun also. So we're going to assemble this and make sure that both tubes are open. So first we're going to put this together, and then we're going to pull the trigger, and you can see that it's squirting both out of both ends here. So this is good, and we're ready to put the tip on now. The tip goes on one way and then turns tight, and this is ready to use. Okay, we're ready to proceed here. Again, here's our crown preparation. We've soaked the model in water just to keep the plastic from sticking to it. Because it's plaster, sometimes the plaster will stick. You can also spray it with some PAM. Again, this is not a problem in the mouth because the saliva will wet the tooth, and plastic does not stick to tissue. Here's our mold that we made from before, and we're going to just try it on the tooth here and make sure it fits all right, and it looks like it does go down. And so we're ready to put our plastic in here. So I'm going to squirt a little bit out on the bib. We always waste a little bit to make sure it's mixing properly. And then I'm going to proceed to fill up this tooth with plastic. Try not to trap any air in there. And fill it all the way up to the top. Some will run into the next tooth. Now we're ready to put it over the top of the tooth and seat it. This will take about 2 minutes to set, so we will come back when it's hardened. But you can see that the temporary is stuck inside here, so I'm going to just gently pull it out, getting the flash out of there. And if you need an instrument to tease it out of there, you can either take one of the instruments or your fingernail in this case. We're going to gently lift it out And there's the mold of our temporary. It's still a little soft yet, so I'm going to put it back on the tooth until it's fully hardened. But I think you can see that it's quite a nice duplication of the tooth that was originally on there. Sometimes these come out with bubbles on them. That does not mean that you have to throw them away. Your instructor will show you how to fix those bubbles with some flowable composite. It's a little just like regular light cured composite, except it's very runny and comes in a syringe, and we'll inject it into those bubbles and voids and we can fix it. It's too much of a time waster to fix little bubbles and voids by remaking the whole temporary. Sometimes you can remake it 2 or 3 times and you still get bubbles in it. It's easier to fix it. This happened to be one with very few bubbles in it, so all we have to do is wait for it to harden, and then we're going to trim it using some acrylic burrs. You can even speed up the set by heating up some water in a microwave and putting the temporary in some hot water. Obviously, you're not going to be able to put the patient's mouth in there, but after you've taken it on and off the tooth a few times and you're sure that it fits, then you can put it in some hot water to harden it the rest of the way. Here's our temporary, still rough around the edges. We have to trim the flash off. You can see little corners and jagged pieces of flash that need to be trimmed off with an acrylic. That follows the shape of the tooth. See if we can get a little closer here. Again, these little edges are what you're going to trim with the acrylic burr. This is an acrylic burr used for trimming acrylic appliances and temporaries in the dental office. This happens to be mounted in a ordinary hardware store moto tool, which we're going to use. Sometimes in the dental office laboratory you'll have a special handpiece for doing this in the lab, but these work just fine. We're going to trim the, again you can see it's got little fine teeth on here for trimming the plastic. We're going to turn this on and start to smooth out our temporary tooth. I think you can see that I'm using my thumb here to brace against the other hand to keep from wiggling. You don't want to try to do this freehand like this, or you're going to be wiggling around too much. So put your thumb on here and you'll do a nice smooth job. You see I'm just following my way around here, just trying to get off the sharp edges and the parts that don't look like a tooth. You know, it's kind of like the old joke. Somebody went up to an Indian at a old trading post who was carving a totem pole of an Indian chief, and the tourist went up to him and said, "Gee, that looks very difficult to do, to carve an Indian out of a log." And the wise old Indian told the tourist that it's not really that difficult. You just cut away all the pieces that don't look like an Indian. So that's kind of what we're doing here. We're trimming away all the rough edges that don't look like they belong. Now you can take this one step further and trim this, or I should say polish this, using a rag wheel in the lab, but remember, it's just a temporary, and if you've done a good job, it will fit nicely for 2 weeks. It's not meant to be permanent. All right, that looks pretty good. So let's see how it fits. Here's our model again, and here's our trimmed temporary. Again, you can see the detail up close. Still may have some sharp edges. Again, we weren't too fussy, and it hasn't been polished with a rag wheel. If you do polish it with a rag wheel, be especially careful when that rag wheel is spinning around and around. It's easy to have this thing just flipped right out of your fingers and have it bounce across the room, and now you're on your hands and knees looking for it. So just a light touch against the rag wheel is all you need if you're going to polish this. Let's see how it fits. We're going to put it back on our patient and push down. And I think that's going to make quite a satisfactory temporary crown for the 2 weeks that it takes to make the permanent crown in the laboratory. So this is your clinical exercise for today to make one of these on your stone models. Just as an afterthought, if you were going to cement this temporary that you just made on your patient, a popular cement to use with acrylic temporaries is something called temp bond. It does have eugenol in it, so if your final restoration was going to be a porcelain crown, you would have to use a temporary cement without eugenol, and a brand that meets that criteria is called Nogenol. It's very similar to this, comes in 2 tubes, except it doesn't have eugenol in it. Eugenol interferes with bonding of permanent crowns anytime they have to be bonded, so you would not want to use temp bond if your final restoration was made out of porcelain or something like that that had to be bonded. But if it was a porcelain fused to metal crown going to be the final restoration, then certainly your plastic temporary could be cemented with temp bond. You'd mix a little bit up, paint some on the inside here, and then again seat it on your patient. This would be your job, the assistant's job. The dentist would not need to supervise this. And then after the cement hardens, you could take an Explorer or a curette and just clean off the edges here. Check the bite one final time, and then your patient can go home and wear this for 2 weeks until the permanent crown is ready.